Are able to see my screen, right?
Yes.
Yes, sir.
So we can discuss the CPT today onwards. CPT means current procedural terminology used for the outpatient procedure codes. Based on the CPT, we can lead the outpatient procedures. So, what is the meaning of outpatient?
Patient discharged within 24
Patient leaves the hospital before 24 hours.
Who discharged within 24 hours. So, here also same. If they perform the procedure in outpatient setting on the same day, we need to use the CPT codes. Clear? Then every year, January 1st, they will update the CPT codes, okay? Which means any new codes, if you get, they will provide every year, January 1st. Okay, what is the code structure of the CPT? 5-digit numerical code. 5-digit numerical code should be the CPT, which means all the numbers will get 5 digits. Okay. So, what is the code structure? 5-digit numerical character 0 to 9 series, guys. So, from the 0 to 9, all the codes you will get in this series. So, what are the departments we have in the CPT? Anybody have idea?
9 series ANM, 7
Outpatient
and 9
department.
series.
Radiology, surgery,
Radiology, same day surgery,
Anesthesia,
Anesthesia,
ED,
ED,
E&M,
pathology,
E&M,
pathology,
medicine,
medicine, then
ED note, and ENM.
ED or ANM.
Integumentary.
Integumentary was not, it was surgery only. Integumentary was just a body system, right? It was not a department. So total we have six sections, guys. These are the sequencing of the code range and sections. So our CPT book first start with evaluation and management codes, ENM. Evaluation and management codes 9800 to 98016, 992022, 99499 was the code range. Evaluation and management was the code range 9800, 98016, 99202, 99499. In these codes, all related to ENM. Here you will get along with ENM emergency department ED also. First, you will get these codes. Then anesthesia 0 series. Then surgery 1 to 6 series. Radiology 7 series. Pathology 8 series. Medicine 9 series. Okay. These are the sections you will get. Check these sections, guys. If you have any doubt, ask me. Evaluation and management, anesthesia, surgery, radiology, pathology, and medicine. Total 6 sections of the procedures. Okay. Clear? So here guys, in the surgery we have medical and surgical procedures. Based on the body system, again we can able to divide. 1 series means what body system, 2 series, 3 series, 4 series, like that. So 1 series codes, you will get integumentary system. Clear? Then musculoskeletal 2 series. If the CPT procedure start with 2 series, it should be musculoskeletal related. 1 series integumentary. Here you will get skin and breast related. Musculoskeletal, muscle, bone, joint related. Then respiratory system, cardiovascular, hemic, mediastinum 3 series. Then digestive system 4 series. Then urinary, male genital, reproductive, intersex, female genital, veterinary care 5 series. Then endocrine to operating microscope 6 series. Eye and adnexa. Then here also we have some series. Auditory system and operating microscope. Endocrine, eye and adnexa. Auditory means ear related and operating microscope. These are the 6 series procedures. Total 6 sections we have in the surgery. 1 to 6 series. Based on the first character, we can identify the code. What is that particular code? Which system that codes comes under? 1 series means integumentary, 2 series musculoskeletal, like that. We can easily identify. Now, see guys, CPT book also we have index and table, standalone procedure codes. Okay, index and standalone procedural code. For each code, we have the separate procedure description. Standalone procedural code descriptions you will get in the CPT. Individual code for each procedure. Okay, like how you are getting the code in ICD-10 CM, one diagnosis, one code. Same here also, procedure, one code. So, but in index, remember the CPT, you will get index at last, guys. If you go to the contents, you will get index at last. For ICD-10 CM and PCS, you will get index first, right?
Yes.
But CPT, you will get at last index. Okay. If you go to the contents, in the contents, appendix, after all the appendixes, you will get index at ending. From here, you need to use the index if you want to lead code in index. I'm going to that particular pages. How to use the index, I will show. Index was like dictionary only. Okay. So here, we need to use from based on the main terms. Based on these 4 main terms, you need to lead the code. Procedure or service name, or organ or anatomical site name, or condition directly they will give, or synonyms or abbreviations they will give. Based on these main terms, we need to lead the code. Under the main terms, you will get the subterms and body parts like that. Okay. Suppose if they given heading abscess, now all the locations of the abscess they will give. If they given laparoscopy, all the laparoscopy related procedures they will give. If they given colonoscopy, all the colonoscopy related procedures they will provide here. Okay. So first thing, before going to index practice, read these code ranges. What they are saying in the code ranges?
If non-sequential codes apply, they will be separated by comma. Sequential codes apply, they will be separated by hyphen.
Thank you. So here they given, while you are leading, sometimes you will get a single procedure, sometimes they will give the code ranges. So if they separated by comma means it was non-sequential code. So we need to check the particular code only. Okay. You need to check these three codes descriptions. If they separated by hyphen, sequential codes, we need to check between the codes also. Suppose here they given 810 hyphen 820. Which means in between all the codes we need to check 811 to 819. Which code exactly mapping with the particular procedure, that we need to pick. If they given non-sequential codes, no problem. Whenever they given the sequential codes, you need to check between the range also. If they separated by hyphen, you need to check between the range codes. If they separated by comma, you need to check just particular codes enough. Clear? Have you got it?
Yes, sir.
Yes, sir.
So now if you go to the index, here they will give from A to Z onwards, guys. A series to Z series you will get. Like this, you will get the location and they will give the procedures. Sometimes they will give the procedure name and they will give the body part. Okay. Main terms we check now abbreviations, scopies or locations. Based on that they will give. So you suppose abortion means all the abortion related. Abrasion related. Abscess, all the abscess related procedures. All the location of abscess here you will get. So I will give some examples for index leading. Try to identify the code ranges. If you find the particular code enough, if you are unable to find, just find the code ranges by using the index. Guys, everyone lead. I don't show how to lead and all again. Don't wait for me. Lead everyone.
Anatomy of tongue.
No problem. All the codes you can lead at it. All the things you can leave at it. Huh? Okay. Lead, guys. Identified.
Yes, sir.
Yes, sir.
What is the code for frenotomy of tongue?
41010.
41010.
Simply you can go F series, frenotomy, F series you need to go. Frenotomy, tongue. Like this we need to check. Clear? Burn dressing, what you find?
Burn under dressing.
16020
16020 16025
16025 16030.
Removal of foreign body, left cornea with slit lamp.
5222
6522
Vulva lesion biopsy.
5660
566.
05
Hmm.
511.
566. Only one code you find.
No, 3 codes is there.
56605, 5660.
56606 56821.
56821. Here laparoscopic cholecystectomy.
Four seven five six eight 47564.
4756.
47562 6364. Then parathyroidectomy.
60500 hyphen 60505.
Clear? Huh? Any doubt?
Sir, how to lead biopsy of valve lesion? That one once you lead, sir.
Under biopsy go.
1 minute, sir. Under biopsy. Okay.
Vulva.
Biopsy. It's showing us.
Biopsy. V series come.
Yes, sir. Okay, sir, I lead it.
Sir, they're giving code ranges based on which factor we have to select that specific CPT, sir.
That I will explain. Don't worry.
Okay.
Just I am
Sir,
teaching
once did
basics, right?
parathyroidectomy.
So you are going on the basics, right? If I will cover by end everything, you will understand. Don't worry, okay? We are not identifying a code. Now just you are identifying, practicing how to lead a index.
Sir, how to lead parathyroidectomy once.
Go to the P series, PARA.
Okay.
Sir, the second one, removal of foreign body left cornea. Where should I set, sir?
Under removal,
Okay.
foreign body, cornea
Okay,
with
sir.
the slit lamp. Okay. Like this, we need to use the index. Now, after finding the some codes, how we need to read the complete description of the particular code? We need the description, right? What is the exact procedure description? Suppose here they given three codes. When we need to code 202530, that and all we know, no? So simple, guys. This codes was arranged in the CPT book in numerical sequence. Okay. Codes was arranged in the book numerical sequence. all the codes they will arrange it in the numerical sequence. Numerical sequence means 1, 2, 3, 4, 5, 6, like that. So based on the sections, first you will get ENM codes in the book. The book start with ENM codes. Then surgery codes 1 to 6 series. After 7 series, 8 series, 9 series. Okay. Radiology after this. Pathology and laboratory. Medicine. Clear? These are the code ranges. Simple. Just check here. On the top check, guys. Once your codes started, na, these all are basic guidelines. Once your code started here, like this, they will give the code. Okay, like this, they will give 4-digit code, and they will give description of the code. So first you will get ENM, right? Here check on the particular page what are the code ranges you will found. In the top of the book they will give on the particular page what are the code ranges we have. Like this 2915 214, like this you will get. After 9 series you will get 0 series medicine, sorry, anesthesia you will get. After 0 series, 9 series, you will get anesthesia, 0 series. Okay, 0 series procedures. Here you will get this code and description. Code and description. Okay, after 0 series, 1 series. 1, 2, 3, 4. Like this, they will give individual code and we need to read each code descriptions. Okay, like this, you need to find a code in the book. Now, how to read the descriptions we can discuss. Read this format of the terminology from here to here. Read this format of the terminology. What they are saying here? For the space conservation, they are giving some main portion preceding entry of the code. Okay, see, CPT codebook are not printed in the entity but refer back to a common portion of the procedure listed in the preceding entry. This is evident when entry is followed by one or more identifications. This is done effort or conserve space. Simple, guys. Here, what is the description of 25100?
Arthrotomy with wrist joint.
Arthrotomy, Suresh.
Wrist joint with biopsy. Then 2515105 they given with synovectomy, but completely how we need to read now? This common portion before the semicolon should be the common portion. This we need to assume here also and we need to read. Arthrotomy wrist joint with synovectomy. Like this we need to read. Complete list. Note that the common part of code 25100, the part before the semicolon should be also considered part of the code 25105. Therefore, the full procedure represented by code 25105 should be arthrotomy wrist joint with synovectomy. Like this, we need to read. I will show some examples. See what is the 11400 description they given.
Excision, benign lesion including margins except skin tag.
Trunk, arm or legs exceed diameter 0.5 centimeter or less. Correct? 11401 what they given exceeds the diameter 0.6 to 1 centimeter. 402 should be exceeds diameter 1.1 to 2 centimeter. 1403 should be 2.1 to 3 centimeter. Simply they given. But what is the original description? No? This common portion is there right up to legs. This common portion we need to assume here and we need to read. While you are reading, we need to assume this common portion. Here also same 420 up to semicolon. Up to here, we need to assume here, like this. We need to assume the common portion prior to the semicolon for the below codes and we need to read a code description. 11402 not only exceeds diameter of 1.1 to 2 centimeter. Up to here we need to read, then exceeds diameter 1.1 to 2 centimeter. Clear?
Say we do not give two quotes.
When required, we need to give. I am asking how to read the descriptions.
Okay.
Just to how we need to read the descriptions here. We need to code multiple procedures if they performed. We need to code multiple codes also.
Okay.
Now, how we are reading a procedure description. Now, so some procedure codes I will give, guys. You can try to identify the descriptions of the particular codes in the standalone descriptions wise. Read these codes descriptions. Just to find in the book these codes you are able to find or not. That's it.
Dressings and or
Can
debridement of.
lead. All you can lead. Okay. Note down all the descriptions.
Okay.
Once you're done, you can tell me, guys. Okay. Facing issue to find the description. So, are able to unable to find the descriptions? Please ask me. I will explain. If everybody able to find, well and good.
Sir, once explain.
For 169,202, explain, sir.
One six
There
zero
is
two
no
zero.
code for 69202, sir.
69202
This code.
is only for 200,205 only we have CPT code.
Okay, leave it there. If not able, leave it. Okay. Maybe I typed wrong. Remaining all you lead it, right?
Yes.
Thank you, guys. Now we get idea, right? How to read the code descriptions and how to lead the index. Right. Now, next concept. Before going to the CPT guidelines, we can do first concept symbols. Okay. Yeah.
Can you lead 47605 once?
47.
605.
You are unable to find. No?
Ah, yes.
You are able to go 47 series
Yes,
to the
sir.
book. 476 you find. If there is no code,
Yes, sir.
I think is there code 47605. I will check. 475 44563 47605. Polycystectomy with cholangiography.
Ah, yes, sir. Now we.
So next concept, guys, note down symbols. These symbols you will get beside the CPT code in the code descriptions. Standalone code descriptions beside, you will get these symbols. Each symbol have a separate definition. We can learn symbols. So revised code means the particular year they revised the code. New code means that year only they implemented the particular code. New or revised text, they means they change the description. Then add-on code. Add-on code. So note down plus symbol add-on code. Add-on code or additional code, same meaning, guys. When primary add-on codes was always dependent codes. Okay, these are always used with primary code only. Do not append add-on code on sequence first. Or without primary code. Okay. So add-on codes we should not code directly. Without primary code, we should not code. Clear? Compulsory, you need to use primary code, then we need to use the additional code. Why we need to use the additional code? Now, sometimes for the what procedure they performed, primary code will not completely match. At that time, for the remaining services, we need to use additional codes. Okay, for remaining services, we need to use additional codes. What is the 11200 description read?
Removal of skin.
Skin tags, multiple
Tags.
fibrocutaneous tags, any area.
In how many
Or
lesions?
15 lesions.
15 lesions.
Up to 15 lesions, correct? Suppose if they done suppose 16 lesions, we don't have code na here.
Then have to add one add-on code.
Add-on code.
So for that, we need to use add-on code. If they done more than
Yes.
15 lesions, here they given see 11201 plus symbol add-on code. Each additional 10 lesions are parked thereof separately in addition to code for primary procedure. For the primary, it should be additional. So below the add-on code, clearly they document for which code you need to use that particular add-on code. With the particular primary codes only, we need to use the add-on code. Here they given see use 11201 conjunction with 11200 means only with 11200 we need to use 11201. Other than the 11200 we should not code 11201. Other than 11200 for any code we should not use 11201. Okay. What they given 11106?
Incisional biopsy of skin.
Hmm.
Single lesion.
Single lesion. Suppose they done more than one lesion. Here they
Plus
given each
everyone.
separate additional lesion. List separately in addition to the code for primary procedure. Report 11107 is conjunction with 11106. Clear? They will give like this prime add-on code. Don't give directly add-on code. If you are coding only 11107, it should be wrong.
Sir, if
When you are
4
adding
lesions,
11107 means
how we
11.
should code?
I didn't get you, bro.
Sir, for 4 lesions means how should we code?
One
Triple one
lesion
zero
here
seven
first
into
you
3.
go na. Tell me.
Uh,
One lesion primary. Add-on code we can multiply how many times you want. Primary code only one time. For remaining add-on code we can multiply more than one time.
yeah, okay, sir.
Okay. Add-on code we can multiply how many times also no problem. But primary code only one time we need to code.
Oh.
Clear? Suppose they done here also 15, 10, 25, 35 lesions they done. Add-on code two times. Okay.
Into 1 or into 2, sir? 11201.
Into 2, 35 means. Into 1 means
Means
why
we
we
should
need to put
write that
1?
we should take that code for 2 times, sir.
That's it. Into 2 or 2 times same meaning. Okay, well, suppose they give an add-on code
Sir, into 2 means it will be 45.
35, bro.
20, 35. Okay.
1 means 1 time, 2 means 2 times, 3 means 3 times.
Yeah, okay.
Done. How to use the add-on code, you get idea. Any doubts regarding add-on code? No, right?
Oh,
No, then stop symbol. Note down exemption to modifier 51. Don't ask me now what is the modifier. Later I will explain. So simply note down exemption to modifier 51. Stop symbol. If you see in this symbol beside the CPT code, do not append modifier 51 for the particular procedure. Do not append modifier 51 for the particular procedure. What are the procedures you are seeing? Exemption symbol. So modifier means later I will explain. Don't worry. As of now, remember, if you see this symbol, do not append 51 modifier for that particular procedure. Then, out of numerical sequences. Out of numerical sequences, which means actually our course was arranged in the sequencing manner, guys. Okay, numerical sequencing manner they arranged. Okay, if any code miss the sequence, they will hint us first where we will get the particular code. Suppose here see, what is the 469459469479448 descriptions?
Code is out of numerical sequence.
Code is out of numerical sequence, not the procedure description, right?
Yes, sir.
They were saying code was missing the sequence. Then where we need to check, they are clearly giving here. See 46200, 46255 in between. If you search in between, you will get 46945. So now we need to go for 46200 in the sequence. 46200. 00220221. Now here see they are giving 46945, 46946. Actually, after 2 to 1, you will get 2 to 3, right? But this course missing the sequence. That's why they are giving hash symbol. Here they given the description, original description of the procedure. What is the 46947? Code is out of numerical sequence C46760 to 46910. Now you need to go 46760 onwards. 46760, 761, 46947. Here they given hemorrhoidopexy for prolapsing internal hemorrhoids. As symbol. Clear? While you are leading a code, if you see in code is out of numerical sequence, they will give hint us where you need to find the particular procedure description. They will give C and they will give the code range. You need to go for that particular code range and we need to find the CPT code description. Any doubt? As symbol.
No, sir.
No.
So you need to remember just hash symbol and plus symbol. Okay, then exemption to 51. That's it, guys. So because now while you are leading, if you are seeing code is of out of numerical sequence, now where we need to find the description, you need to aware. Add-on codes don't code primarily and don't code alone. Add-on code we can use multiple times. Only with primary code. CPT guidelines. So guys, before going to the chapter specific guidelines, we are discussing some basic guidelines. These are all the things we need to use for surgery. Basic guidelines of the surgery coding. First, surgical package. Then, imaging guidance. Then, okay. These four concepts we can discuss now. What is the meaning of surgical package generally? Tell me. Package means tell me.
Which will include all.
Hmm? Package generally normal not needed coding point version. Generally tell me what is the meaning of package.
Operative procedure inclusive.
Service cover. Sum of list of amount.
I didn't get you.
Sum of a list of amount.
Sum of list of amount. Then what are the things they are provided? Okay. If you go to any tour, they will tell tour package. What is that meaning
Yes,
of tour package?
it includes this all like that.
what was includes, what was excludes. They will clearly tell us before going to the tour itself, right? In this tour package, these are only covered. We should not provided some local transport or entry charges like that. They will clearly hint us before, right?
Yes, sir.
If you go to any tour, same here also, guys. Surgical package means before performing the surgery, what are the things including along with the surgery? What should not include? They will give a clear document for us. Okay. Along with the surgery, what additional benefits they provide? It was simply definition. Okay. Clear? Huh? Along with surgery or procedure. Suppose if you go to procedure, any surgery, before going to the surgery, we can discuss with the patient, right? I will pay 50,000, 60,000 like that. While we are discussing with the surgery package, they will provide the medicine in the surgery. Hospitals will provide the medicine, or we need to go for medical shop and purchase again.
We'll purchase.
To
We need to
purchase.
purchase personally, right? They don't provide, just they will give the receipt. That's it, right? We need to buy the medicine. Suppose you done the surgery. After 1 week, you go for the surgery checkup and they remove the sutures. For that, they will charge?
Yes.
Yes.
No,
No, no.
they don't charge.
No, no, simple.
They don't charge for that. Just they will check how it was healing and they remove the sutures. It was common thing. It was included in the surgery. So like that, they provided what are the things included in the surgical package. For this, we should not require to pay anything. So this is the surgical package definition, guys. These are all the things included along with surgery. Just to read this all the points, 6 points. These all are included in the surgery, like local infiltrations, digital blocks, local anesthesia, nerve blocks. These all are included. Then prior to the surgery, they taken decision or pre-operative. Then immediate post-operative care, dictating operative notes, talking with family and other patients, other qualified healthcare professional, writing orders, evaluating the patient in the post-anesthesia recovery, and typical post-operative follow-up care. This all the points included in the surgery. Along with other than this, we need to pay for the remaining services. Like bed cost, room, based on your interest, they will arrange. For that, we need to pay extra. Okay, general ward, separate. We have no. Based on that, we need to pay. Only these are the things included along with surgery. Read once all the 6 points. Guys, stay up to 9:30. Okay, don't leave in between. People are joining only half of the days. Noted, huh? Read it, guys. So what is
Yes.
the last point they are telling? Typical post-operative follow-up. What is the meaning of post-operative?
After completion of the
After
surgery.
the surgery, the patient coming for
After
the
the
follow-up
surgery,
of wound.
After the surgery, if any complication or issue with the surgery, if they follow up, that should be considered as post-operative follow-up. Correct? So we have time limit for the post-operative, guys. Minor surgeries, 10 days. Major surgery, 90 days. Okay. Minor surgery is 10 days, major surgery is 90 days. This is the post-operative time period. If the follow-up within the post-operative time period, it was included in the package. After the time period, if you follow up for the particular surgery, complication also we need to pay. Clear?
Yes.
Surgical package, typical local anesthesia, digital blocks, all are included in the surgery, guys. Don't code local anesthesia or nerve blocks separately when they perform surgery by using that. Next guideline, imaging guidance. What is the imaging guidance means? CPT,
The
fluoroscopy,
imaging is to execute the procedure.
ultrasound. Sometimes no, they will perform the procedures under imaging guidance. Okay, they will use the help of imaging guidance and they perform the procedure. Okay, so when they performed procedure under imaging guidance, check surgical procedure code description. If imaging guidance
Included.
includes in description, no need to code imaging guidance code. Note down, okay. If not included, imaging guidance description,
Should be reported
in
separately.
surgical code, code imaging guidance separately. Just note down. Okay, modifier means I will tell later. Don't worry. This concept note down. So guys, whenever they performed under imaging guidance, we need to check the surgical procedure code description. Imaging guidance was mentioned in the surgical procedure or not. With imaging guidance, they will document. If they mentioned with imaging guidance like ultrasound, fluoroscopy, No need to code that ultrasound or fluoroscopy separately. If they're not mentioned, they performed under imaging guidance. We need to use that imaging guidance 7 series code additionally, and we need to append modifier 59 for the imaging guidance procedure. So everyone lead 13005 description in the CPT. Lead this course description, guys. 13005 and 13006.
Fine needle aspiration biopsy, including ultrasound guidance. First lesion.
06.
Each additional lesion.
List separately in addition to code for primary.
Below that codes, what they given? Under 13006.
Use 13006.
Use 13006 conjunction with only 13005. Then
Do not
not
report
use
10005, 10006 in conjunction with 76942.
which means we should not code 7694 to ultrasound along with 13005, 13006. Why? Because in the surgery description itself, ultrasound was included, right?
Yes.
Yes, sir.
See, including ultrasound. So no need to code ultrasound again. So while you are coding any procedures, read this parentheses. These are a lot of helpful. So now they given question like this. A patient with 3 thyroid nodules is seen for fine needle aspiration biopsy using ultrasound guidance. The provider inserts 25 gauge needle into each nodule, means 3 nodules. Nodular tissue is aspirated and sent to pathology. What CPT is reported? What is the exact answer?
Option B,
Option
sir.
B.
Option B. Based on the guideline, we should not use 7694 to write.
Yes.
Yes.
And option D, they given 13006. 13006 should be add-on code, right? 13006 only add-on
Yes.
code, no? We
Yes.
should not code plus symbol code directly, right? So option D eliminated, and 7694 to ultrasound included in 13005 and 13006. So B, C eliminated. Then only AC eliminated, only B. 13005, 13006 into 2. Each first lesion, each additional lesion. Total 3 lesions. 3 nodules or lesions. For 1, then into 2 means same code 2 times we need to code. Into 3 means 3 times we need to code. Into 1 means 1 time we need to code. So that's why they don't put into 1. Clear?
Yes.
Yeah.
Lead the second question answer.
Third option.
20553. P.
D option.
Option
C
D.
option.
C for dog.
B.
No, sir.
C.
D. D.
C.
B
D.
option, sir.
C.
D, sir. D. D.
D. Any other option got? Check here how many muscles they triggered.
1.
25-year-old is coming for trigger point injection for right-sided thoracic spine pain. 3 points are injected. Deptomedrol injection on the rhomboid major muscle under the fluoroscopic imaging guidance. One muscle they done 3 triggers, right? Read
A,
the
sir. Option A.
20552 and 553 descriptions.
552 is injection, single or multiple trigger points, one or two muscles.
So here
55.
muscles should be important, right? How many
Yes,
muscles they are triggered,
yes,
not
sir.
points, correct?
Yes, sir.
So
Option B, sir.
one muscle
Option
only
D.
get triggered.
Option D.
Option D. Very good.
Yes, sir.
Now you understood, right? Here they not mention the fluoroscopy. That's why we are coding additionally fluoroscopy imaging guidance code. If they're not given the description in the CPT, we need to code additionally. If they're given, no need to code. So here also they're given clearly see under 20552 and 553. If imaging guidance is performed, see imaging guidance code. We need to code the imaging guidance. Next, open or scopy. See guys, while you are working in the PCS, based on the approach, we are getting the fifth character, right? If they performed laparoscopy 4, colonoscopy 8, bronchoscopy 8, thoracoscopy 4, like that, you are getting the approach value, correct? Percutaneous endoscopy, via natural or artificial opening endoscopy, open procedure approach. We are getting different approaches in the fifth character in PCS, correct?
Yes, sir.
గుర్తున్నాయా లేవండి? So, but in outpatient, you will get completely different code. If they performed open, you will get under excision heading procedure. Okay, separate procedure here. If they performed under scopy, you get procedure under scopy heading. You get under scopy heading. That's it, guys. Open scopy, you need to check. They perform the laparoscopy under laparoscopy heading, endoscopy under endoscopy heading. If they mention the scopy, you need to go with the scopy procedure. If they not mentioned scopy, default open. What is the keywords to search the procedure performed scopy or not? No, note down. Procure, video, visualization, scope, copy. Okay, these are the keywords for Scopy, guys. If you see in this, what's in the operative note, you need to alert for the Scopy. What Scopy they used? I will show one example for the same procedure. If they use the Scopy, how we will get code? If they performed under open, how we will get the code? See here. Check it was open or Scopy. Anywhere they mentioned Scopy in the document. They mentioned anywhere Scopy in the document. Check.
No.
It's open, exposed.
No, sir.
No, right? We should not find any Trocar videos, Scopy visualization. No. So simple, guys. They given four options. Now 47605, 7000, 562, 563. We need to go for that particular code ranges. 47000 biopsy completely wrong, right?
Yes.
Here they not mentioned any biopsy, wrong. Next 475. See 47562 and 63 we are getting under laparoscopy heading, correct?
Yes.
So these two also wrong. These are to scopy related. This is the biopsy related. So 47605. So cholecystectomy along with that cholangiography they done. So 47605 description. Cholecystectomy with cholangiography. Cholecystectomy with cholangiography. 47605. Clear? Huh? So same procedure. If they performed under scopy, how we will get the document? I will show. Same procedure only. See here. Cholecystectomy, cholangiography only. But they performed under trocar was placed. Trocar means laparoscope was placed and they done the procedure. So now it should be laparoscopic cholecystectomy with cholangiography, correct?
Yes, sir.
So now check 562 and 563. 562 only cholecystectomy. 563 cholecystectomy with cholangiography, laparoscopy heading. Then what is the answer here?
563.
47563. So same procedure only. Check here how you will get scopy means. Here completely different code if they performed under scopy. Okay. So while we are working on the procedure, operative finding, check all these things. What are the things included in the surgical package? They performed under imaging guidance or not? Under they performed open or scopy. These three things we need to apply for each surgical procedure. 1 to 6 series, all the surgical procedures. You need to append these guidelines, guys. Clear?
Yes.
Any doubt as of now? I hope everyone understood, right?
Yes.
Okay, guys, thank you.